diagnosis where the patient was dehydrated, but you said that was a medical diagnosis.
Uh-huh.
And they had like a family history of diabetes or whatever.
Right.
So if we take like the person's blood glucose, if we check their blood glucose level and we see that it's up, we still can't say, as nurses, we can't say that's hyperglycemic. That has to be
right. Well, we don't, as far as it's not a nursing diagnosis, but there is a nursing diagnosis for that, Ananda one, and gosh darn it, I'm trying to think what it is right now.
But the doctor would have to be the one to say it's hyperglycemia.
Well, as far as we can still do our own nursing diagnoses for that.
Okay.
Like, because we're caring for the patient, but it's not hyperglycemia. That is the medical diagnosis.
Okay.
But there is a NANDA one for that. What is it? Something like, oh gosh. Oh my God. Glucose. Could it be something like, isn't that awful? I don't see it very often and I can't think what it is.
Okay.
I know there's an ANDA one for that.
Okay.
So, yeah. Good question. All right. Okay. All right, guys. So, again, I always like these. And, of course, you're going to get these on NCLEX, too. And what we're doing, too, right now is kind of practicing some of those strategies for NCLEX. Even though you might not even be aware that we were doing it, we are. And this is one that we're doing that you're going to get on NCLEX. So again, you have a group of patients. You're on, let's say, a med-surg floor. You're the LPN. You got report again. Who are you going to go to first? Patient has a respiratory rate of 22. Patient who has just received a diagnosis of cancer. A patient with a blood glucose of 42. And a patient who reports pain at a level of 2.
Blood glucose of 42.
The blood glucose of 42.
That's exactly right. Yep. Very good. That's the one who has the high priority or the physiological need that is in the life-threatening situation, possibly. Very good. Very good. Okay. All right. Okay, so can somebody tell me what intellectual empathy is?
Trying to be in that person's shoes.
Very good. Very good. So, if you have a patient who, and you guys know, and if you're techs, you know this happens. They're upset because no one's been in for a while, and maybe they want their pain medicine, and no one's been there. So now you're the LPN and you're passing meds, and you do have their pain medicine. It's just that you didn't get there right away, okay? So you walk in, and this patient's yelling at you. I've asked for that 10 minutes ago. I'm gonna report you. Okay, so can you tell me which one of these would demonstrate the best? And in a way, you can think of this as therapeutic communication too. Which one of these would be the best way